previous?
40 or 52 kilos in ruptured AVM.
Oh, okay.
And apparently his dad died of cancer 3 years ago, and so he's taken over the family farm, but obviously.
What are we taking again?
Heart, liver, lungs, kidney, pancreas, and then a single kidney.
So we'd like to take a moment to thank Alexander for his gift and for the family for consenting on his behalf, and just take a moment of silence, please. Is everyone okay to go ahead?
Mm-hmm. Yes.
Thank you.
Okay, starting, please.
Give the knife.
Can I get my headlight, please?
Check this out. For starters. Take the palm left.
Do you want to do that vessel cup too?
Okay, pancreas is coming out. Do we have the...
Yeah.
Excellent.
Wow, those are some beautiful ones.
Okay, so... Oh, I don't know. I mean, you could split it and then sew it together closer. Like you could cut some out of there. I don't know.
The next time I see you have new lungs, you're in the ICU, okay? I'm gonna hold it snug so you just get oxygen and not room air. Big, slow, easy breaths. Here we go.
On the count of 3, I'm gonna pull the tube out, okay? But you're gonna have to take in a nice deep breath for me. Does that make sense?
Just a nice deep breath, honey.
Okay, so I'm gonna pull these tapes out behind your head here. Thank you. Okay, you ready?
Remember, deep breath, honey.
So on the count of 3 here, okay? 1, 2, 3. Nice deep breath in.
Okay, let's go to E4, printer list, and are we going to ICU next? Morning, how are you?
I'm pretty good.
Doing all right? I'm Dr. Shapiro. Yeah, we've met before.
Yeah.
So we're still planning for Friday then? Operation Friday? Yeah. Okay. You might need to go back to the dialysis again a little bit after the surgery. It's always a possibility. Yeah, I am happy to see that, yeah. I am happy. Thank you. You guys, when you come past, you should do this firmly. A quarter of our patients will die waiting for a transplant, and we're desperately short of organ donors. Yeah, some of them will wait years for a transplant in certain blood groups. Some of them will go straight, close to the top of the list because they're so sick. Many people will die waiting because an organ doesn't come in time. James Shapiro. The team should be there setting up, so we won't lose any time.
I'm so scared.
I'm always get a second chance. Right? This is it. This is your second chance.
Yeah. Yeah.
Everything's gonna go good.
Yeah.
Okay, I think we're ready to go.
Are you?
Yes, we are. You ready? All right, you want another hug? Kiss?
Yeah.
High five?
Okay. I love you.
Love you too.
Okay.
It'll be good. Everyone will be good. Got a good team here.
Take really good care of her.
Yeah, you got a good team here.
All right, take good care of her. Yeah.
This patient is very sick. She has what we call a high MELD score, which means that the liver has been very diseased, very scarred, a lot of pressure in the veins, a lot of risk of bleeding. I mean, this isn't unusual for us, but it's, yeah, as with any liver transplant in a sick patient, it's an extra challenge.
And flagell.
We're going to give
She
you a
have
little bit of
a nasal in
oxygen
there
here.
somewhere?
Comes
Oh,
through
it's
this mask,
flagell.
okay? It might smell kind of funny, but you're just breathing oxygen. Okay?
I think we'll plan on all
Yeah,
that.
see what it is after quantum.
Yeah. So our plan here, I guess, is just to rehearse things a little bit. Let's just put some fresh sponges in. Can you see how horribly diseased this liver is? It really is. It's horrible, yeah?
The end result would be, if she doesn't get this now, within 3 months, I don't think she would be here anyway. So that's how critical it is. It was a very tight timeline for her. So you can't say that it's definitive that she's going to be all right, right? There could be lots of problems. And the end result of some of them is death, right? So it's a tough decision, you know? But it's one of those things you have to do. Either you live or you die. And it's not fair, but these things happen in life, and that's the way it is.
Okay. So now we can lower the liver in. Yeah. So now the liver enters the field. When you watch a new organ come to life like this and you put new blood in it, seeing, you know, a pale brown organ come to life and thinking, what an incredible thing to do. And it never fails to, give me some thrill to see life come back into an oven like this. Crazy high levels. Just, good. Good job. Good job. Emily?
Oh, thank you.
Oh,
Okay.
you got more than I had.
Yeah. Somebody has end-stage liver disease at one moment, you release the clamps, and now they suddenly have a new chance at life again. So it's a wonderful privilege to be part of that.
Okay, good to go.
You know I'm here, don't you? You're getting there, Patty. Yeah, you're getting there. It's a long haul, but you'll get there.
We love you, son. You are our boy, our love boy, our love child.
Matthew, right now is when we need you the most. The doctors are going to be doing some tests, and these results of these tests are so important, son. This is when we need you to shine like you've never shined before, son. Please, please shine.
Everybody join hands, please. Everybody join hands for our son. Everybody pray.
Matthew, please, this next couple hours is so important to you.
I'm a baptician. Please,
You
pray.
need
I'm a
help from a
baptician.
person to help from you, Matthew.
You can do it, Jesus. I want the whole boy back. I want the whole boy back. You're such a good boy. You're such a good boy. You're so kind. You're so kind, Matthew. You're so giving.
But we know how important these tests that are coming up. And what we're trying to do is get something in his brain working so it's worth, give a sign that we can carry on with him. And that's what we are. We're just trying to stimulate him. We're hoping that his brain reacts. And when he goes through this battery of tests, is so important of what happens after. The doctor has explained to us that this is a very big decision making, and we're just praying and hoping that there is enough there that we do move forward with him. We're terrified that if there isn't, the results aren't really what. We're just scared. He's gonna do it, Les.
I know he is. Please.
He's gonna do it.
I know you're gonna do it.
He's gonna do it.
I know you are, Matthew. I believe.
He's gonna do it. He's gonna do it.
You're gonna do it, Matt.
We're just hoping that by reaching him, it can help him. And we're asking him to give his fight. Even though he doesn't fight, this one he has to fight. And I hope he beats the hell out of it.
Matthew, I'm gonna put a hat on your head, okay? So it's gonna feel a little snug. How much propofol is he on?
300.
300? Okay.
Yeah.
And he's having jerking?
Yeah. Not sure if it's myoclonus or seizure, so.
Matthew? 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 Any response to pain at all?
Just abnormal extension.
Okay, but nothing.
Matthew, I'm gonna just pinch your finger, love. Okay, right now. Yep. So we started our myoclonic jerking.
Okay. Oh, there we go.
Okay there, Matthew. It's okay, I'm all finished. Matthew. Hang on there, Matthew. Okay, honey?
Our whole world was turned upside down. Just in the matter of 20 minutes, my whole life changed. My whole life changed.
Apparently, Matthew was getting a tattoo, and the story is a little mixed up and foggy, but he was left and they came back and he was unconscious.
Matthew, I'm just gonna do some flashing lights.
In 1 minute, we were such a content family and just felt so lucky. They're such a good family. And then, bang.
All right, Matthew, we're all done.
I know it has to be analyzed, and I know that is the waiting game. This is a very scary day for us. We do know we were told 72 hours. We do know these tests are going to show a lot, give some answers. I'm very afraid of what the answers could be. Trying to have more hope, but fear is there.
Everybody's going to feel the ramifications of what's happening here, so we've lost a lot of very young members in our family that it's horrific. I don't even understand how we could lose so many young, potential, amazing people. You need that family support. That is what a person needs in this scenario. There's no real right or wrong way to feel at this time, but knowing that you have the love of your family, it's very important. And I'm so thankful for everybody that we do have. And I feel very sad for people that don't have what we have as a family.
I've been pacing up and down these hallways, and all of a sudden, it reminded me of when Matthew was born, and the similarity of me pacing that hallway, and it struck me I was waiting for a birth of Matthew again. That's what I'm waiting for. I'm waiting for a birth.
Hello. Hi, honey.
So we're just going to go a little bit over the things that you've been discussing before. Is everything clear to you? Do you have concerns? Does something new come up? Do you know kind of what you have to expect? And you know that that the perfusion of the heart with blood, so oxygen going to the heart itself, is dependent on that small chamber that is not properly formed on the right side. In her situation, I don't think there's much dispute about which is the right way to go. I think we all agree that transplant for sure gives the best chance to lead a long-term as close as possible to normal life. You do know, however, too, that it's not going to be a walk in the park. We can go in a very good condition into the surgery, and we know that in this condition, the babies usually do very well. It is exchanging a life-threatening situation in which she is now with kind of a chronic disease or chronic abnormality. So you know she will lifelong depend on taking medications. But reality is, with the babies, the first 2 years are a bit of a struggle often. And in children that are immune suppressed, that can cause a lymphoma, which is basically a type of leukemia, and that's not that uncommon. It's hard to even imagine how that feels, right? Like you go through all this, you go through a heart transplant, everything goes well, and then suddenly something like that strikes you. But I think it's, in all fairness, important for you to be aware of that as a possible option, but also be aware that 90% of our kids do really, really well. So if you have any questions, just find us anytime.
Okay.
I only talked all the time now. Which is pretty common, actually.
Yeah.
Sounds scary.
Yeah. Hope for the best.
Yeah, you think about going through the whole heart transplant and then maybe later on dealing with cancer or something like that. It's terrifying. It's just something we gotta do. We love her and just want her to have the best life she can possibly have. So.
I don't know if we really have many options at this point.
You tired? You sleepy?
He's got 5 beautiful grandchildren that he's living for. He's got to watch them. He's got to bring them up right.
I hope so. I didn't make it this summer. Last summer, I took my 2 grandsons, caught their first fish.
I'm glad you guys
No
came.
problem. Yes. Good way.
I finally talked him out of being stupid.
Yeah, I'm not
Did ya?
How you doing, Dad?
Didn't matter.
A bit better?
Quite a bit better than I was.
Yeah. Looks like it didn't stop sticking you any.
No. They're still stabbing me pretty regularly.
Yeah.
Still bruising like hell. Same old, same old. You beat you with a chair.
I can
I think
stand.
there's
I
one
just
right.
sat for a plane ride and sat on a bench and sat in a truck. I'm good.
How are the kids?
Good.
All of them?
Good. Yeah.
Oh, yes.
Oh, yes.
Filled with mischief. Mine are anyways.
I think they have a big problem. They haven't had Grandpa for a while to treat them right.
Yeah.
You guys make them follow the rules,
I
eh?
know. Nobody's spoiling.
Yeah.
I'll make up for lost time.
I know you will.
I'll go over here for a minute. Give him some time with the kids.
How's things going?
Good. Good, good.
Waiting sucks.
Yeah, no doubt.
They upped me. I'm a level 4 now.
That's good.
So. The trouble is, I'm too big. Our lungs are too big.
Having trouble finding a match?
Yeah, they've been getting lots of smaller hearts, but not big enough for me. So, see how it goes.
When did you get put on level 4?
Today.
Today?
They told me about it today, so we'll go with that.
Well, it's good that you're next in line, though.
Yep.
You have to think positive. You know, that's all you do is you hang on. Well, Mama's always told us that, you know.
Hold on and quit.
Yeah, the difficult you can do now, the impossible only takes longer. So this is a little like impossible, but it's just going to take longer to have it done.
He essentially needs a heart. And, you know, he's going to need a fair bit of rehab afterwards, too. It's not going to be an easy road even after the heart transplant. And I think he acknowledges that, too.
Hey, Doc.
Hey, Bill, how are you? Good to see you.
Better today. A little better today, yeah.
Better today. So one good thing is, you know, the ultrasound for your heart didn't show any worsening fluid.
Okay, that's good.
So that's at least one positive.
You gotta get something right.
Yeah. So I cut back your steroids, so your sugar should be better. I'm hoping that you get some sleep, because that's probably why you're not sleeping as much. So you're probably the highest status person in Alberta right now.
Yeah.
Your muscles are getting weak, and your energy, your sodium is
stand up this morning.
Yeah, I heard you had a little fall. My concern is, and I've seen patients like yourself who get weak. You were once a pretty big guy, and I don't mean in the stomach, in the muscles
You keep
too.
right up the hormone and down the hall.
Well, not in that group. I mean, like, you have more muscle, and when you're sick, your body preferentially uses muscle for energy. And if you get too weak, the outcome for going for a transplant is far worse than being sick and heavy. Does that make sense? So I want to prevent that from happening. So I'll just get you lie down. I just want to see your neck here, and then the other thing with you being weak is just kind of take it easy when you're getting up. I know you're so used to doing everything on your own. Last thing I need you to do is fall either on your chest or your head, and then we got a whole set of other issues, okay? And I'll be here the whole weekend, so I'll keep you updated every day, okay? Anything else I can help you with?
Find me a heart.
I'm on it. Okay, talk to you later.
Okay, thank you, sir.
All right, if you need anything, just have Brandon give me a shout.
Okay.
It would almost make sense that if somebody has viable organs when they pass, that it should just be an automatic thing where, you know, you take them from them and give them to those that need it the most, and then that lessens the strain on the medical system as much as possible. This year I'll have completed 20 years with the Edmonton Police Service. Right now I'm on long-term disability, so I've been off work for just about 2 years now.
150. Yeah, that's good enough.
When you have a family, there's always many things on the go. Like, there's, you know, competitions coming up. She's a competitive diver, so we're hoping that she qualifies for nationals. And with that will come travel. So you're trying to plan for that, but, like, can I get dialysis there? Am I gonna be well enough to travel? Am I gonna get the call? Like, am I possibly missing out on getting an organ because I had to put myself on hold for a week to go to a competition because I could get dialysis there? Just planning Lana's birthday.
Oh.
She turns 40 on the 23rd, so I think she'll figure it out when my parents show up at the pool, take Izzy home. Nobody says anything before then.
Why can't I go to dinner, Dad?
Because they don't let minors in there.
Well, that stinks. And I can just press it.
You try and do what you can to be as healthy as possible, or at least as alert and have as much energy as possible. But going from, you know, having a parent that
goes to work, is like every other parent in the world, and then hangs out on the weekends, and you go do stuff to planning your life around this machine. She came up one night, and she saw the tubes in the arm and stuff, and she had to leave. She couldn't. It just wasn't tolerable for her to see. See you after.
Yeah.
Come here, B.
Love you.
Love you. Have a good sleep. I'll see you in the morning.
Bye, Daddy. Love you.
Well, it cleans out the blood. I don't know, I don't feel any different, really. I feel kind of wiped the next day. I'm pretty used to it by now. So it's just that's my routine. 3 times a week I'm here late. If I was at home, I'd be in bed already.
What I'll need is a 4x4 and
Right.
the flashlight if we have it.
Sure. Yep, I do.
You may turn on the light now. So. You're able to. You can come in if you wish. I'm just repeating what we did this morning. Okay. You can hold his hand if you wish.
My son, my beautiful boy. You're so blessed, Matthew. You're so blessed.
He will be moving. We just stopped the drug for the exam, and then I'm just going to put this in his mouth to check his gag reflex. So. Okay. Would you like to stay here? I'm just going out to the family conference room to meet with your family. Would you like to stay here or join me?
I want to join you.
Okay. We'll come back.
Yeah.
You have an opportunity to come back, so
Yeah.
we'll just go out there now.
Okay, so girls, please stay with them, okay? I'll be back.
I love you, Matt. I'll be right back to see you. I love you, love you, love you. I'm so scared.
There's no need to be.
I'm scared.
Do we have everyone here that you would wish here?
Yes.
I'm Dr. Koutsianos. I'm the attending intensive care unit physician this week here. I've been caring for Matt since Monday. As you're aware, he had an episode where his heart stopped for a prolonged period of time. It was at least 20 minutes before he recovered his blood pressure when we look at everything from start to finish. He's been ill in the ICU. He's been comatose in the ICU. He's had many irregular movements that we do see sometimes in these circumstances. So I examined Matt this morning and this afternoon, and what we look for is different basic reflexes in the brain that are often preserved even though we're not conscious. If our upper part of our brain doesn't work, by that I mean we can't communicate, we can't understand. Often the lower part of our brain, which is very primitive, still works. So we're in a scenario where just by examining him, and I had mentioned to most of you yesterday that it didn't appear that he would recover his brain function, although we can't tell that just by examining him early on. We have to wait till approximately the third day. For more solid proof that he won't recover his brain function, I had organized another special test yesterday to be done today. So both examining him and based on a test, I can tell you with a great degree of certainty that he will not recover brain function. So we're left at this circumstance where I don't think any family would want an individual to be left on life support in this circumstance in the long run. I'll stop here to ask for any questions currently.
No, no, no. God, they can't be safe. This is a nightmare. Oh my God, this is a nightmare. Oh my God.
Are there any people that we may be missing here that may want to see him or he would want?
Are these mothers showing up?
Tonight, why is that? Or why is that?
Well, I think at this stage, I'd recommend that he, in the long term, by that I mean days, not stay on life support, because we're really prolonging the dying process.
So what you're also saying, there is no miracle?
I'm saying that I can tell you with
it's done, yeah.
Pretty good. We don't want to make an error in this situation because you can understand it's someone's life.
Yes, I understand what you've...
There's very few things that we can say in medicine that are fairly solid, and this, I think, from our experience worldwide, is I can give you a good degree of certainty.
Yes, I think it'll be best.
Les, what do you think?
Yeah, I just want to be by Matthew's side. Now I know I'm saying goodbye. He's such a special boy. I personally would like it the sooner the better, because I don't want him to be in this state, this comatose. I also find this very hard on all the family and friends. Like, the hurt is just...
You're not alone. We see this not infrequently, and it's a common...
Yeah. I just see everybody's gut-wrenching feelings, and all I want to do is hold my boy for the last couple of days or hours that I have.
Just let us know how many chairs you want in there, and that we can organize that. We can let his arm rest down. I think that's...
They're down.
Okay.
Yeah.
Oh, boy.
We'll be okay. I gotta go be with Matthew. Now, when I walk out, the boys are all gonna look at me, and I'm gonna go like this, and then I'm walking straight to see Matthew. So good luck with the guys.
I have one more thing that I want to discuss.
Mm-hmm.
It's an obligation on my part by
I know
law
what you're gonna talk about.
Yes.
by law, I have to discuss this, and now that after we've discussed the issue of taking them off life support at some point in time in the next few hours or days, and that is the issue of organ and tissue donation. So I think I just plan to open the discussion. I don't think it sounds like the intention is that you would want to take him off life support tonight because he's got other family coming, but it's an introduction to that to think about, to discuss, and we can have another discussion tomorrow regarding that.
Leslie. I love you.
Thank you.
You're welcome.
No. There's no chance. There's no chance. Matthew will leave us. There's no chance. There's no chance. There's no chance. There's no chance. My boys, there's no chance. My boys, there's no chance.
So I've been caring for this young man, Matt Chishin. He's 28. Came in Saturday evening after cardiac arrest. He's lost some, but not all of his brainstem reflexes. And I had organized for somatosensory evoked potentials today, which were done, and they showed no conduction on either side of his brain. So I finished meeting with his family. It's mother, father, a brother that just arrived, and a sister and some cousins, and his girlfriend of 10 years. And I talked to them about withdrawing life support because that was really the only option in this circumstance. And I approached them about the possibility for organ donation, and they will be deliberating on it. You know, if they're interested, it wouldn't be till tomorrow because I think they wanted to have more with family, see him, and have more time with him.
It's hard to see a human being in the situation that Pat's in, but we've seen it enough times that we know that we can pull people through. Yes, I can see there's a lot of resources gone into Patricia. She's been on a ventilator, then she's trached, and then she's plugged. She's receiving antibiotics. She's sitting in the intensive care unit, and that's expensive if you put a dollar figure to it. But it's a temporary situation, and she can pull through. This isn't her liver's working really well now. So if we can do one simple maneuver, yes, all right, it's a surgery. It's not complicated for me. It's an incision, drain the fluid, close. So that to me is a no-brainer.
It's a big collection. So, the thinking is take her to the OR and drain that collection, wash it out, send some cultures off, and then we can tailor antibiotics towards that if she needs ongoing therapy.
From surgery-wise, it's a pretty straightforward surgery to do. I don't think it's going to set her back too much, but she's got that trach in place. She probably is going to spend some more time on the vent. So, Scott, go ahead. We'll do the dual physician consent form. We'll book her as an E6 and we'll get it done. Yeah.
Thank you.
Okay, thanks, good. Yeah, thanks, Winnie. Surgery is an absolute detail-orientated profession. You know, every detail matters. People have to be thinking, you know, where does the incision go? Where does the retractor go? So it's all about the surgeon and the assistant. It's a very important dynamic.
Well, what would you do, Scott? You're into this, and you get a big pool of bile.
We get a bunch of bile?
Yeah.
And leave drains.
Don't bother putting the Thompson on. Let's have 5 sponges per side, and 4 towel clips, please.
An assistant like Scott, who I've worked with a lot, you know, I know he's done a full surgical residency. He's done 2 very intense years now as a multi-organ transplant fellow. I know that I can trust him. I know that if he's helping me with something difficult, I can trust that he'll be putting his hands in the right place and exposing things in a way that I need to see.
Scott himself had a liver transplant when I first arrived in Edmonton in 1993, and it's incredible. Here he was, 14-year-old boy, right? Yep. And I spent hours and hours, not only in his surgery, but by his bedside while he recovered, and got to know him and his family very well. And now it's incredible. He is here training exactly the shoes that I was in at his stage. And he's going to be a brilliant liver transplant surgeon. Yeah, I learned all about liver transplant from looking after him.
It's 4 more packed cells and maybe 2 more FFP.
When you set on a journey with transplant, you take in an organ that can save somebody's life, and it does save people's lives. So you have a responsibility. Once you set off on that journey, I mean, probably the most important thing is making the right decision at the beginning. And once you've made that commitment, you've got to make sure that you do everything possible to get a successful outcome.
I knew it was going to be hard. I knew it was going to be hard. For one thing, she was so ill when she came in. Then she was in the hospital for 5-6 weeks before the operations. She was sick. She didn't have much time left. Months probably. Probably by now she probably wouldn't be here. So this is a life-saving situation for her. Now we've got to get her through the rest of it. Because I know that Dr. Shapiro has done a good job. He's quite happy with things. The liver's functioning properly. All her vital signs are good. In Pat's case, very complicated. So kind of knew it was going to be.
I want to go home.
Oh, you're not well enough to go home, sweetie. You're going to be a while yet.
No.
But you're on the right path. It won't be long now.
Okay.
They got that infection, everything under control now. Now you can really start to heal.
Okay.
Your new liver is doing very well.
Okay.
Okay?
There's lots of pressures. People will, intensive care unit docs, others will approach you and say, this is hopeless. We've been here for 3 months now. We're on dialysis. We're on this, that, and the other. We're making no headway. We should just pull the plug and let the person die. And I can also see the till tallying up, every day how much money's gone into it. But, we've got to think more than how much is a person's life worth and how much to give, how much not to give. You've got to think about the value of the organ. You have a huge responsibility to the organ donor family and to the organ to do what it's meant to do, which is to save a life.
I think probably the list, more so than the dialysis, the list itself becomes the overriding factor on absolutely everything. Because you get to that point on the list where you're, okay, 1.5 years, 2 years on, you're like, I should be getting close. So you're always just kind of waiting. Like, you always have your phone with you. You don't turn it off in movies. You leave it on at nighttime beside your bed, and you're in that perpetual state of waiting. And that's a weird thing to go through. Watch out for the dog.
I know.
Ideally, it'd be nice to, you get the kidney, the surgery goes well, recovery goes well. So in about 6 months or so, you're healed up and life's pretty much back to normal. You want everything to go as fast and as smooth as possible so that there's no disruption on her life. I want to be done with this part. I want to move on and, get to be able to go on holidays and go to work and live a normal life.
You're running out of options here, aren't you, Doc? You're scaring me.
A lot of us were fearful and we thought we might have to pull the plug and say, no, we can't list him like this. And so that's why, it came to a head, and both the surgical team, the medical team, the ICU team all came together and said, we got to do something or do nothing. So we actually went ahead and implanted a secondary mechanical device, which is a temporary device. It's not a permanent one compared to what he had before. So we've almost essentially bypassed the whole heart.
I want a chance at this. I've already invested how much time and energy into recovering? What am I going to do, quit now? I've worked too hard at this. So, I have grandchildren.
Yep.
That's what it really means to me. It's unbelievable. I want to get out and do things with them. And I'm willing to fight for that. If it was just for me, I'd have probably gave up. But I want to be there for my grandkids.
Christy, it's Karen Holt.
Hi, Karen.
Hi.
How are you doing?
Good, thanks.
Good.
And you?
So I'm actually calling you with a heart offer. You have a couple high status recips.
Right.
Do you want me to email you the chart? Or?
Oh, sure, that'd be great.
Okay. Do you want me to give you the CTR numbers too for your...
Oh, sure, that would be great. Thank you.
I know that. I guess you can kind of guess what's going on if we're coming with the big team and not stay at the bedside. So we actually do have an organ for her, which is a pretty good organ, a little bit smaller child than her. And it's going to come from a little bit further away, so we still have a little bit time today. From what we guess now, it's going to be sometime tonight, probably around somewhere between 8 and 10 that she goes to the operation room. And then coming out sometime tomorrow morning. So just wanted to give you a heads up. We're pretty happy about it too. I think it's actually the perfect time. And it is a very good organ. It's going to be, everything should be pretty straightforward. Okay.
No, it's the car and the van are for the same purpose. People and equipment. So we are now en route. Okay, great. Thanks, Paul. Okay, bye.
What questions do you have? Just excited.
Yes.
Yeah. So it's going to be a couple of tough days, of course. It's a surgery. It's a long surgery, and don't be worried if it takes long. So the way it's timed is that we will try to have the heart removed at the time that the other heart comes in the door, pretty much. So she will go into the operation room before, well, maybe around the time that we obtain the heart from the other place. And only if everything is fine, they will go ahead and open the chest.
We're doing a pediatric heart recovery to transplant into a little babe in Edmonton. So time is of the essence, and what we call the time from the heart is stopped till the time that it's beating again in the recipient. There's a very finite time, which is like for adults about 4 hours where that time is, and then for peds they maybe upwards of 6 or 7. They don't like that, but sometimes you have no choice.
Guess what, Tatum? Huh?
Arlo's gonna get a new heart.
Wow!
Say yay.
Oh,
give me a hug. Oh, Arlo's getting a new heart today. Tonight. Thank you. I prayed for it all week that it would happen this week.
Did you?
Okay, so I'm just thinking here out loud. So 10 o'clock if we're done, 11, 12, 1, 2. So it looks maybe more like 3 o'clock would be our ETA.
So right now the baby is completely asleep. So we're gonna prep, and then we open the sternum, put the retractor, and do all dissections. Well, when we open the pericardium, we need to visualize the heart. Be sure the heart is good. There is no any congenital malformation, and the heart contractility is fine. There is no tumor. There is no any pathology or any problem with the heart.
ETA 9:30, 10:30, 12:30, 1:30, 2:30. Hi, Jenny. Karen. Hi. So the heart looks good, and our ETA looks closer to 3.
Make your hair nice and greasy for your surgery. You're crying with something. I know.
Single cannula and as we see. What's the ICT?
425 is fine.
Okay, go on bypass, please.
Use mine is open.
Cool down to 34.
Up dry, 3 or 4 degrees.
Mm-hmm. Was Venus in too far?
Yeah, I was about 8 centimeters too far.
That's right, yeah. Okay, mixture. You can cut across there. Mm-hmm. Yep. Okay, 4 50C1s. Look here. That's good. Tag, please. That's good. Tag, please. Another stitch. Another. Okay, that's good. Okay, let's have a look. Hold off the RPA there. Let's see the new heart. They said no. Okay, that's okay. Good size. Okay, thumbs, please. Mm-hmm. You can go through the transverse sinus. Okay. Okay, you can tie that knot there.
This one?
Yep. Yeah. Okay, this is wound around here, so just take that driver off, or the tag off. That's nice. Okay, perfect. And I'm gonna take this clamp off the PA for the moment. Pull this over here. And the heart's starting to beat already. That's cool.
We need another clamp set.
Okay, we need another angled clamp.
I'll grab one off the other chair.
The size difference is not huge. We can go like 2 or 3 times body size in a baby. If it's, we got to be careful it's not too small, because if too small, it won't have enough pumping capacity. So it's a good heart. It came from a long ways away. So it was in the bucket there for like 5.5 hours, huh? Okay. Hi. Mr. Burgundy, I'm Dr. Rebecca. How are you? Good. So we're all done. Everything went very, very well. The heart started up right away, and getting it in wasn't any major issue. So heart's working on its own now, and we're just going to wait for the bleeding to settle down just a little bit before we close up, and then the baby will go back to the ICU. First 24 hours is sort of the important time. Heart's got to recover from the operation, and all the bleeding's got to settle down, so it's a bit early to relax completely. But things look pretty good, so I think we're in good shape. Good. Okay? Thank you. Okay.
Thank you. Thank you.
We don't shake anymore because there's too many germs, huh?
Sure enough.
Okay.
Thank you.
I'll talk to you later, folks.
This has been a great big blackout to me. Yep, big blackout. And when I found out I almost died, that was something else. I even saw, you know how they say that you see a figure before you croak? I saw a little Virgin Mary. Oh, is this Dr. Shapiro?
It is.
Oh, hello.
Pat, how are you?
Good.
Very nice to see you again.
Yeah, nice to
Congratulations.
see you. Huh?
Congratulations to you.
Thank you.
It's been a long haul, hasn't it?
Too long.
Yeah.
Yep.
It was difficult transplant.
Yeah.
You were very, very, very sick before it.
That's what I heard.
Yeah. Anyway, times are going to get
Times
brighter.
are gonna get
a lot
better.
brighter for you. Yeah.
Yep.
You've got a new chance.
Yep.
It's very lovely to see you, Pat.
Yeah, it's nice
Yeah.
to have met you,
Yeah.
my
All right.
lifesaver.
Well, likewise. It's been a pleasure to look after you. We'll see you in the clinic.
Okay.
Okay, keep your spirits up.
Yep, I will.
Okay. All right. Lovely to see you, Pat.
Okay, bye-bye.
Okay.
Sometimes I wished I wouldn't have gone through all of this. Kind of hard. All my wasted days. It would have been better just to... I think anyway. But I thank the person. That's all I can do. That's all I can do. He gave his life to save mine, which was nice. Sorry for the tears.
You have every right. You have every right.
Yeah, you're welcome.
Okay, now. See you in a bit.
Look, it's full.
You take a picture?
Yeah.
Good.
I don't think anyone would call my life balanced, but I certainly have more control over it now than I've ever had before, and I know what the priorities are. It's taken me a while to learn that. When you're young and fresh and trying to prove yourself, it's not quite the same. You know, you feel you have to, every invitation you have to take, every grant you have to apply for, every paper you have to write. Now it's different for me. Well, I had an event 2 years ago when I was thought fairly healthy. Could run down a quarter every day. And one night, in the middle of the night, I got out of bed and I fainted on the floor. And I went to emergency, and I had a temporary pacemaker put in, and then a permanent pacemaker, and a bunch of tests, and I was found that I had a condition called cardiomyopathy. And I had no idea.
It's not bedtime yet. It's too early for It's too early for bedtime.
So I had this pacemaker put in. It happened during a vacation. I don't think I lost a day of work because of it. And I haven't turned back since. I've been able to, do everything that I've done before.
So are we reading this one?
Yeah.
I don't know what this is about. Is this about us?
But look.
What I've learned is life is precious and time is precious, and I want to look after my patients. I want to have fun doing surgery, have fun doing research, and I want to come home early. I want to have it all, and I've learned that actually by letting go of a lot of things I can do that. And and I feel very lucky. Ready for songs? Into bed.
Matthew was born here, and it's kind of sad that he started his life and finished his life in this hospital.
We were so proud that he was born here.
So we have all agreed that we will, Matthew's organs it will be donated. That is
which
a
are
given.
listed as, like you said.
Yeah, I can go through all that specifically.
Yeah.
When it comes to the tissue, we did not realize part of the skin part was to the degree, and we did not realize the need for it at the same time. The eyes, not so.
I don't know how much Matthew has to give. Matthew's already given his life, and we don't have to. Yeah, we don't have to do it all. You know, we're already, you know, he's already given, but I don't think we have to do it all. You know,
Dane, he's your brother.
What?
I've said my piece about it. I say, do the organs, the essential organs, and leave the tissue. I don't feel comfortable about the tissue. On my own donor card, I don't donate if that's the case, just my organs. And I just don't, and then Leslie just said it.
Mm-hmm.
Everybody's done enough.
Yeah.
And Matthew has contributed more than all of us, so.
So basically what'll happen is that if for organ only, there would be a cut probably from around an Adam's apple for a male down to the pubic area, and then usually just across from the abdomen to abdomen. And so other than that, there should be no visible scarring or anything if we go just for organ donation.
Now, Leslie, let's do the organs.
Part of the process as well requires us to take part of the spleen.
Mm-hmm.
So,
pardon me?
The spleen. So the spleen basically is attached to the pancreas, and we use that tissue to determine his tissue typing matching to the recipient. So, yeah, basically the spleen is just they take a piece of it just to check his genetic typing versus the recipient's, because what they want to do is match the donor organs to the recipients as closely as possible, so that there's less chance of rejection or having the organs fail. But it's not really an organ that we're taking or anything like that. It's just basically a tissue sample that we're using to make sure that the match is the best match possible.
Leslie, it's all right. Matthew would be okay with it. He honestly would be.
Okay, let's sign. I have to leave. I want to sign this. I feel nauseous. Can we let's move forward, okay? We're moving too slowly for me. Let's move forward. You know, we're being all this delicate, and I need to get to my son. Let's move forward.
Do it. With the giving person that we know Matthew was, we would know that this is what he would have wanted. He would have done it without hesitation.
Hi, could you tell me who's on call for lung transplant? Hi, Karen speaking.
Hey, Karen.
Hi, I'm Allie. I have a lung to offer you.
Okay.
I do not have HLA or serology at this point in time.
Okay.
But we're trying to rush this as quickly as possible, and we need to go to OR today before midnight.
Okay.
Oh, Matthew. Oh, Matthew, you should be filling out that form for me. Why did I have to fill that out for you?
So these lungs sound promising. They have multiple recipients, and liver, I still have to get a hold of that liver recipient. Kidneys, that sounded promising, I think. Okay. I think I'll talk to the lab just to see that serology will be done and HLA will be done, and then give a couple hours flex and really firm that OR time. Okay. So that everyone can tee up their recipients.
They're going to fix me up. They're going to give me a new heart. They've got according to Dr. Sharma, and from what I've heard since I got here, they got an excellent heart lined up for me.
The best, yeah, perfect.
Yeah.
Hi, Mr. Warden. So, right here.
Pleased to meet you.
We have found you a very good heart.
That's what they tell me.
Yeah, it's a very good quality heart, so I'm very confident you're going to do well. So, of course, there's lots of complications that can occur along the way.
Yeah, well, hey, there's nothing ventured, nothing gained, right?
Yeah, that's right. But things like bleeding or infection,
bleeding,
or having troubles with your lung function, or kidney function, or
Yeah.
things like that. And any one of those things can contribute to you not actually making it through this whole experience.
Yeah.
Which that risk is probably in the 10 to 15% mark, I would think.
Yeah.
So quite a bit higher than usual. But I think
Nothing ventured, nothing gained, right?
I think given the fact that we've got this heart for you, we should go ahead. That's why we've gone to all the trouble of getting this organized.
It's going to do
Good.
well.
Absolutely.
Power of positive thinking.
Exactly right. Good. All right. Glad I got a chance to chat with you.
Yeah.
See you soon.
See you soon.
Okay.
I'm a little nervous. I'm ready to start the final leg of this journey. It's unbelievable how good that feels.
You guys can go sit down over there if you want or something. Just relax, because the best thing is to do is just be with someone.
The OR has delayed. They would like to delay for 1 hour. Oh, okay. I wonder, can I call you at a different phone, Darren?
I want to wake up from this nightmare. I just want to wake up from this nightmare. I can't lose him. I just don't want to lose him. I'm just being so selfish. I just don't want to lose him.
This is not abnormal. This is pretty routine, but in this case, it's much more sensitive, and a delay is much more, maybe not received in the same, as it's more difficult for the family, maybe in this situation, to have a delay. So,
Are we withdrawing?
not quite, yep, pretty soon. We're just gonna have a minute of silence. This has been an incredibly stressful time for everyone because it's been so busy. But this family has really, really hung in there. And this is a loss of their son. And it's been really, really hard on them. And as always, it's so totally unexpected. So they have graciously agreed to consent for transplantation. So if we can have like 5 seconds of silence to just remember the gift that this family is willing to give through their son. So they're going to withdraw life support like any minute now.
Okay, what I will need from you in sequence is the scalpel, followed by the sternal saw, and I'm going to put the DeBakey's and the meths in there, so I have that up already.
Sounds like they're coming.
Thank you.
Go, Matthew. Go save some lives, Matthew. Go do it, Matthew. Goodbye, my son. Goodbye, Matthew. Goodbye, my son. Goodbye, my son. I will see you again, Matthew.
I'll call you when we're done, okay?
I'll see you again, Matthew. I love you, Matthew. Goodbye, Matthew. I love you, Matthew. I love you. I love you, Matthew.
Okay, so we're gonna go into the right.
Here they come.
I know.
Feet first. Yeah. See? That's okay. Great, Teresa. Who's checking the ID?
Passing the
Thank you. Okay, suctions up to Dr. White. Give me the skin knife, please. Skin knife.
Second blade, please.
Knife moving.
The liver and...
Not the liver, but the pancreas can.
Okay.
Perfusion cannula, Karen. We need a pulmonal bleed, please.
Yep.
Right away, please. Saw off retractor. Yeah, we should be able to take the whole thing out. Where's the pulmonal bleed cannula?
Yeah. Wonderful. Thank you, Chris.
Suctions up to Dr. White. Give me a skin knife, please.
I'd like to thank you all for joining us here tonight as we pay tribute to and remember Matthew.
He lived his life how he wanted to, and he lived his life to the fullest with no regrets.
I love you. I miss you. You're my friend, you're my best friend, you're my brother. And I'll see you again.
So the other thing was Matt was really, really generous. He was really giving.
That's what made him such a joy, even for Leslie and I. He's probably put Leslie and I on more adventures than we could shake a stick at, just by spontaneous taking us out there and have us live life full.
We want you to know that Matthew was an organ donor. We knew that he would want to give this gift of life to someone who needed it. Our load was shared by so many, and our son was so loved by so many. We want you to know how grateful we are